If you hear any whining or anything, that's my dog whimpering outside the door. Hi, my name's Maddie and I'm going to be your nurse today.
Hi, Maddie.
I'm going to be giving you a physical assessment today. I'm going to provide for privacy, perform hand hygiene, and put on gloves. Could you tell me your name and date of birth?
Mandy Stone, 12/20/76.
Okay, and that lines up with your wristband. Could you tell me if you have any allergies?
I don't.
Okay. You've already told me your name. Could you tell me where we're at?
Deaconess Hospital,
And do you know around about what time it is?
7:30.
Okay. And why are you here today?
Stomachache.
Okay. All right, I'm just going to go ahead and get your vital signs. I'm going to have you put this on. Put this under your tongue. Okay, I'm going to get her temperature orally, but you could also get it audically or rectally or temporally. Okay. All right, your O2 saturation is 99 and your beats per minute is 70. Your temperature is 98.2. Okay. I'm going to go ahead and get your blood pressure now. All right. That's 120/70. Your respiratory rate is 15, which is within normal limits. Your depth is full, and your rhythm is consistent, which is all normal. Now I'm going to assess your general appearance, your development and growth match your age, which is great. You don't have any striking features, anything that looks to be of concern, like sunken in cheeks or dark circles or anything like that. You look well groomed. You look like you showered. Your hair looks nice. Hygienically, you look good. The nails look kept. You smell like you showered, so that's good.
That's good.
Behavior-wise, nothing of concern. You're not shaking your feet. You're not staring me down or biting your nails or anything. So I'm going to write that down. Okay. Communication-wise, also great. You have not slurred any words or spoken too quickly for me to understand. You're not having trouble understanding me. Now I'm going to have you stand up and we're going to get your height and weight. The weight is right here, the scale. Okay. I am assessing her gait as she's walking to the scale, and her gait was steady. You weigh 180 and you're 5'8". Okay, perfect. Just give me 1 second. I'm going to give you a gown and also a urine cup, if you could just go pee in that for me. Okay, and I'm going to go ahead and put on my gloves to collect my urine sample. If you want to walk back towards me now. I'm still measuring her gait as she's coming back to me, which is steady. I don't sit down yet. Urine sample is clear, yellow, no odor, and it's 120 milliliters, which is great, normal. That's what we want. I'm going to flush this, dispose of the urine sample cup, take off my gloves, and perform hand hygiene. So now that we have assessed your gait, which is steady, your posture is erect, which is also great, I'm going to have you do the Romberg test. So I'm going to have you put your hands at your sides and close your eyes for 20 seconds. All right, perfect. If you want to have a seat on the side of the bed there, you didn't experience any dizziness or anything like that?
No.
Okay. You were balanced for that. No odor, 120 milliliters. Clear. All right, now I'm going to test your patellar reflexes. So I'm just going to hit your knee and you see if they jump. All right, they're both reactive. Present. All right, now I'm just going to check your hair, the texture, the color. Color is brown, texture is fine. It's a little bit thin, but it's clean and there are no parasites present or anything like that. Okay. All right, now if you want to lay back again, you can. Okay, now I'm gonna go ahead and check your eyes. Could you tell me what that calendar says right there?
August.
Okay, perfect. I'm going to test and make sure that your pupils are equal, reactive to light, equal, round, reactive to light, and they accommodate for light. So, could I take your glasses off, please? I'm gonna have you look at that piggy bank up there, and don't look at my pen light, okay?
Mhm.
Okay. All right, perfect. Pupils are round, equal, accommodate for light, and they are about a 5. All right. Now I'm going to check your mouth and your nose. So could you give me a, put one finger over your nose and sniff through the other? Okay, sounds good. Nasal patency is clear on both sides. Your mouth, let me look for your mucous membranes. Okay, those are pink, moist. Could I have you stick your tongue out like this? Okay, say ah. All right, can you wiggle your tongue like this? Okay. And have you had a cough recently?
No.
Could you go ahead and just give me a cough? Was there any sputum present?
No.
Okay. All right, now I'm just going to check your ears. I'm going to check the external and then internal. Okay. The other one? All right. Both are clear. All right, now I'm going to perform the whisper test. I'm going to stand 2 feet away from you, and I'm going to whisper. And could you cover one ear? All right. Pineapple.
Pineapple.
All right, now the other ear.
Banana.
Okay, perfect. So you passed both of those with flying colors. Now I am going to check your neck. So I'm going to check your carotid artery on both sides, okay? Okay, +3 on the left side. And +3 on the right side. All right, could I have you, we're going to do range of motion next, so could you look down and then up and then from left to right? No stiffness or aching? Okay. Range of motion is full. All right, now I'm going to move on to your lungs. I'm going to listen in 6 spots on the front and the back. Just breathe normally, okay? Okay. They are clear, not congested. You want to set up for me? Expanding to full. Let's see. Are you having any difficulty breathing or anything like that?
No.
Okay. Okay, pause. I did forget something on eyes, so we're gonna make up for that. I'm also going to test you for astigmatism. So could you take off your glasses for me again? I'm going to have you follow my light, okay? Alright, that's normal. And I'm also going to have you put this in front of your eyes and you don't have to hold it.
No.
And I'm just gonna push it out and then put it back in. Alright. Pupils. They're right. They're normal. Okay, you can put these back on. Okay. So your expansion on your lungs was great. It was equal on both sides. You didn't have any wetness of the lungs, nothing concerning. And your back, from the back, it was clear too. Now I'm going to listen to your heart rate, and I'm going to listen in two different places. I'm going to listen for S1 and S2 first, and I'm going to listen for a minute. All right, that's normal, regular rhythm. All right, and the apical is also regular rhythm as well. Your beats per minute was 70 as it was earlier. All right, now I'm gonna check your abdomen, and you did tell me earlier that you were having a bellyache, so could you point to me where the bellyache is? Okay, so like down here-ish.
Mhm.
All right, first I'm gonna listen for vowel sounds. All right, vowel sounds are present in all quadrants. And so she told me that this down here was the painful portion, so I'm going to palpate that last. You let me know if anything hurts, okay?
Mm-hmm.
Does that down there hurt?
No.
Okay, great. And have you had a bowel movement today?
Yes.
How frequently do you have bowel movements?
Every day.
And are they formed?
Yes.
Okay. And you don't have an ostomy, I assume?
No.
Okay. Do you see any blood in your stool?
No.
And you told me you had a bellyache, but is there any nausea or vomiting or anything?
No.
Okay. All right, I'm going to check your skin next, just to make sure that there's no areas of concern. Okay. All right, color is within normal range. I'm also going to go ahead and test your turgor. All right, that goes back down within 3 seconds. Texture is smooth. You're warm, which is good. No lesions or anything like that. I'm going to go ahead and look for your capillary refill, which is I'm going to squeeze the end of this finger and it goes back to normal color in 3 seconds. Do the same thing down here for your legs. You don't have any scratches or anything that you want to,
No.
nothing like that? Okay. Color's normal, texture's normal. Push down and look for edema. Okay. Same thing on this leg. Okay. Generalized edema, no edema. Okay. I'm also actually going to check your feet for any sores or thing like that. Nope. And check in between the toes. Okay, I'm going to check, actually I've got to check your toenails too.
Okay.
Make sure they are round, they're unpainted, normal color, normal texture. See these fingernails? All right. Okay, now I'm gonna have you do range of motion. So we're gonna do your right arm first. Could you just give me a bend of the arm? And then your left arm? Same thing with your right and left leg. Okay. Alright, I'm gonna have you squeeze my finger with one hand as hard as you can. Okay, the other. Alright. And will you push down on my, there you go, yep. Alright, the muscle tone is present. Alright, now I'm going to be checking all of your pulses. So we're gonna start with your carotid. Okay, that's +3 on both right and left side. And then I'm going to check your brachial. Okay. We're supposed to do these at the same time, actually, doing this one. Okay, doing these at the same time. All right, brachial is +3. I'm going to check your femoral, which is right here in the crease of your groin. Alright, it's present and it's also +3. And then I'm going to check the backs of your knees for pulse. Alright, that's +3 and present. I'm going to check your ankles here. Alright, right and left are both +3, and then I'm going to check your feet right here. +3 as well. Okay. Also need to get your radial pulse as well, both sides. Okay, those are +3 as well. Now I'm going to check your genitals. So is it all right if I touch you?
Yes.
Okay, I'm just gonna expose you here. And I'm gonna check for any hair or abnormalities or any parasites or anything of concern. And there's hair, no parasites, no abnormalities. All right, could I have you roll over to your side for just a second? I'm gonna check your spine and your coccyx. And I'm gonna touch you now, okay?
Okay.
Okay. I'm checking if the anus winks. It does. It winks at me, so anus wink is present. You can go ahead and roll back over. I do know on mouth and nose that I forgot to palpate the sinuses, so I'm going to go ahead and do that now. I'm going to take these off of you for just a second. Okay, I'm going to palpate. Are you feeling any sore or pressure or anything like that?
No.
Okay. And for the neck, I forgot the lymph nodes, so I'm going to do that now. Okay, so you're going to have this one up here underneath the chin, and then these right here a little bit behind those, and then the tonsillar ones right here. And then you have the subclavicular, which is, you've got your collarbone here, and it's right there in the middle of it on both sides. Okay. Okay. All done. Thank you. Also, I forgot at the end to take off my gloves, perform hand hygiene, provide for comfort and safety, leave the room, and document.